Pop quiz number 51. The client with acute renal failure is recovering and asks the nurse, will my kidneys ever function normally again? The nurse's response is based on knowledge that the client's renal status will most likely 1. Continue to improve over a period of weeks, 2. Result in the need for permanent hemodialysis, 3. Improve only if the client receives a renal transplant, or 4. Result in end-stage renal failure. And the correct answer is 1, continue to improve over a period of weeks. So look at what type of kidney failure we're dealing with. We're dealing with acute kidney failure. So we expect those kidneys to start to get better, and it's going to take a couple weeks, anywhere between 3 to 12 months for them to recover. Now, choices 2, result in the need for permanent hemodialysis, and choice 3, improve only if the client receives a renal transplant. We would expect that in a patient with what? End-stage renal failure, not acute renal failure. Look at choice 4, result in end-stage renal failure. Well, we would expect a patient to end up in end-stage renal failure after they've had what? Chronic renal failure. So guys, when a patient has acute renal failure, there's something that suddenly happened, a severe illness, something that happened that caused those kidneys to shut down. But as soon as that's resolved, we expect the kidneys to start resolved. That's acute renal failure. Then you have chronic renal failure, where this has been a long time. This has been a long time that this has been going on, that the kidneys have just been declining in function. And then finally, that patient will get to end-stage renal failure, where they're going to need to be on dialysis or get a kidney transplant.